I'm Kathryn Tart. I am a graduate from the UT Health Science Center nursing program, and a long time ago, 1987, and I have my master's degree. At that time, we had our master's degree in a specialty, so mine is medical surgical. And then I got a minor in administration and a minor in education because I just didn't know which one I wanted to do, so I did them both. And so actually that was a smart thing to do. I was a clinical nurse specialist, and once I got my master's degree, I was able to teach as well. So my husband and I moved from San Antonio, and I started my teaching career at a community college in Victoria, Texas. And then I moved and finished my doctorate at the University of Houston, and taught at Texas Women's University in the Texas Medical Center for a number of years, and then moved into the University of Houston system, where I'm now the founding dean for the University of Houston College of Nursing. And I'm also the Humana Endowed Dean's Chair for the College of Nursing. So it's been a wonderful experience for me as dean. I love the opportunity to interact with my students. I love the opportunity to interact with our community of interest, and making sure that we're educating the next generation of nurses. I think we've been in this nursing shortage period for a very long time. That's how I first started teaching, actually, because there was such a dire nursing shortage. But it is the truth. We don't have enough nurses, and so I feel very passionate about this work, and always have. So I feel like I'm in a great space for it. And when I was a student here, there was a nursing shortage going on at that time as well. And our school really prepared us to be leaders, I believe, because the UT Health Science Center really saw that vision of making sure that they were educating that next generation of people for the future. Some fun facts. I was the only civilian in my classes. The rest of them were through the military. They were there because they were military people. So many of my classes, I was the only civilian. I was very fortunate. I got a nurse traineeship grant through the federal government, and I am now a big supporter of Title VIII funding, because that funding really helped me to be successful, to be a faculty member, and then ultimately a dean. So that support from the federal government was really critical to my success, and I was able to get that funding here at the University of Texas Health Science Center when I was a student. As a student here, I was very involved with my family life, and very involved with my student life. So I was able to meld the two together, which was great. Some of my faculty, I've got to remember Sue Ellen Reed. She was my advisor in the graduate program, and I would go into her office and just talk about the different things I needed to do to be successful, and what I needed to do to kind of move forward in my career. And even after I graduated, I would call her and ask her certain things about her opinion about what I should do as I was moving forward in my career, where I should go to doctoral programming and different things of that nature. And so I don't ever feel like that relationship ended as soon as I graduated. So, and I like that when our students call us back too and work with us. Don Johnson was my first clinical faculty member, and I believe we went to the VA hospital. I remember him very well. Margaret Bell was another one of my faculty members, taught in the curriculum course. Glenda Butenarescu was also one of my faculty members. So just had a lot of good memories of those faculty. So I was inducted to Sigma Theta Tau International with the chapter here at the University of Texas Health Science Center in San Antonio, and I think that was another. I've never not had membership in Sigma Theta Tau. I've been a member since 1987, so it's one of those things that, and been able to be a member, a charter member of two other chapters. So for my undergraduate program in Decorah, Iowa, Luther College started a chapter. And then our chapter at the University of Houston, we have a Phi Chi chapter. It was the 500th chapter in the world. So that was nice. So that beginning of Sigma Theta Tau happened here for me as well. So Sigma Theta Tau International is the only international honor society for nursing. It is a fraternity of nurses internationally, and so Sigma Theta Tau is a place where we come together, the highest ranking students in the program, the top third of the program get invited. It's invitation only. And also we could also invite members, nurse leaders, into Sigma Theta Tau. So Sigma Theta Tau is at its core is about nursing research and moving the knowledge of nursing forward. The Virginia Henderson Library is another wonderful resource and benefit of the nurses who are members internationally of Sigma Theta Tau. And it's an honor to be invited into that sorority or fraternity of nurses. Education and training of nurses is foundational. Without education and training, we would not know what we were doing. This is at the core of who we are as a profession. So it is so much fun to take care of patients. It is so much fun to be in the hospital or a clinic and have that one-on-one with your patients every single day. So I feel like nursing education gives nurses that opportunity to have that much fun and to work that hard and to know that they're making a difference in people's lives every single day. So, but they can't do that without education. So the education piece is the underlying scaffolding of pulling us all together to make sure that what we do is the very best for our patients, right? We want to make sure that what we do is evidence-based, that it is supported by the literature, supported by the research. It's not just because that's what somebody told me to do. No, we do what we do because of the background that we have through the research that comes to us from the education. So we are always lifelong learners. In nursing, we can't not be lifelong learners because our profession changes, because our profession finds new knowledge, and that new knowledge then has to be imparted to the next generation of nurses so that we can care for our patients the very best way that we possibly can, based on the evidence, based on the literature, based on the education that's provided for our students in that wonderful world of education and training. When I was a graduate student here in 1987, I had absolutely no desire whatsoever to go into education. I still do love patient care. At my core and at my heart of hearts, I am a nurse. 100%. I am not an academic. I am a nurse that loves patient care. So I had to come to some kind of cognitive dissonance in my brain that said, what am I going to do? How am I going to marry these two ideas together? So I had some really wonderful mentors. When I graduated from my program here, the world just opened up to me. So I would suggest anybody who's interested in going to get their master's degree in nursing, go, because your world just becomes 10 times larger because there's that many more things that you can do. So I was recruited by a director of a nursing program. She came to my home to interview me. She was so desperate for nursing faculty. So desperate. I want you young people to hear that. I'll come to your home too. So desperate for nursing faculty because we need them so badly. And so once I realized that I could help in a small way, I thought, with her, and then I was raising my children and wanting to work and working part-time. So it was something that I did on the side as an adjunct. I was adjunct faculty. But I will tell you that first taste that I got of being a faculty member and putting into practice what I had learned from my master's degree in my education classes and really just saying, I'm responsible for this group of students, it was life-changing for me. And I was hooked. I loved it. And what I wanted to do then, after I had done it a few semesters, is I wanted to be a better educator. So all of a sudden I thought, man, I could make a difference now with this group of students, taking care of these groups of patients. I'm dealing with this cadre of physicians, and so you just have this great, big, huge, broad opportunity as an educator to kind of see the impact that you're making on that individual patient's life. So, and then also the student's life. So then I really was hooked. So that's when I went back to school. At that time, I got my doctorate in education because I wanted to be a better educator. So with my master's in nursing and then my doctorate in education, and it's in higher education administration and supervision, I was able to couple all of that together. I used my master's degree in nursing every single day of my deanship. I used my doctorate of education every single day in my deanship because that really brought together, made me a better educator and made me understand the academy. So there's more outside of nursing, right? There's more than just what we do here in colleges and schools of nursing. There's a whole academy of education and higher education. And so how does nursing fit within that academy? So you bring it up just that one greater level into the larger world of academia, and then how do we make a difference? How does our practice profession make a difference in higher education? And that's where nursing should be. We should be in the larger academy because we do make that difference. So I use both my master's degree and my doctoral degree every single day of my deanship. I couldn't do it without both of them. Dean Patty Hawkins was my dean when I was here, and I always looked up to her. Didn't know a lot about her as a person, but I did find out some things later on about her. She was always very busy, but she made time to come to classes or to talk to us in the hallway or to have events near her office. And so we were able as students to partake and be present with that. Another person who was probably very influential for me here was Carolyn Gunning. Carolyn Gunning was a faculty member and taught in the administrative area of my administration elective and a minor. And when I finished my doctoral degree, I interviewed at Texas Women's University in the medical center, and Carolyn Gunning was the dean of that College of Nursing at TWU. So then my faculty member became my dean, and then Dr. Gunning became the provost at the Texas Women's University. So then she became my provost. So nursing, we have these very long relationships with one another. So, and they're very influential because we care for each other just like we care for our patients, right? We care about that next generation and helping people move forward. And I think it's a testament how important education is. And so how does that influence me? So as the dean, I want to be very involved with my students. I do things like coffee with the dean every semester, making sure that I have a chance to talk with students. We have a very informal coffee, listening to what their concerns are, their hopes, what they aspire to be, encouraging them to go on and get their graduate degrees, and listening to their stories of their experiences as students. So I think when we can interact with our students and when we can share our own stories, then students can say, hey, I could be that person, or I can connect with that story. That story sounds like my story in some way. And so those connections help us to grow and help to mentor people forward, because we will need those next new deans coming forward to manage and to lead and to have the vision that all of our nursing programs have to have. Creating new knowledge is really at the heart of what research is about. And so how do we create new knowledge for nursing? When I went on into my doctoral program, that's when I really became very acutely aware of creating new knowledge for our profession. So even though my degree is in higher education administration and supervision, I did all of my research, all of my work under nursing. And what does that have to do with nursing and higher education? And in those days, the late 1990s, we were working on a concept called critical thinking in nursing. And so that was my dissertation. Do we think critically as nurses? How do we know that, and why do we know that? And I still hear that today. I still hear people talking about, oh, well, that nurse is not thinking critically. And this is what I learned in my research. What I learned in my research is that when nurses use the nursing process, they are bringing together the elements of critical thinking. So when we do our assessment of the patient, that's information gathering. When we make a decision about what their nursing diagnosis may be, we are making inferences about a plan of care and a goal that we develop. And then when we evaluate that, we are also making sure that we are using these elements of critical thinking. So if we can line up the elements of the nursing process and line up the elements of critical thinking and bring those together, those constructs really come together and make, my research showed with my factor analysis, that it is the same. So when a nurse says about another nurse, that nurse is not thinking critically, my first question is, what part of the nursing process are they not using? So if we're not gathering data, if we're not assessing people, and this is one of the things I hear a lot about today, nurses aren't doing really good assessments. They're doing these tiny little focused assessments, maybe on their patients, but not really getting in there and doing a good assessment. And if you don't have the information, if you haven't done the assessment, you don't have the information, and you cannot make critical thinking judgments or plans or inferences. So these pieces, what are we missing in our nursing process to say that we may not be thinking critically about patient care? And so that's helped me as I teach, obviously, and it's helped me as I've moved forward. The other thing, too, is part of my work has been in academic progression in nursing. So as we're learning, it depends on what area of nursing, what degree we're seeking. If a nurse is seeking an associate's degree or seeking a bachelor's degree, they have a different educational process that's going on. So they can't learn everything that they need to learn in the associate degree level. They have to move on to the bachelor's degree, and that's one of the goals that we have for nursing, that 80% of our nurses achieve a bachelor's degree by the year 2020. Well, this year in the state of Texas, we have 61.7% of our nurses at bachelor's or higher. So we're not going to make the 80%, but just a few short years ago, 5 years ago, we were at 48%. So we have made significant progress with academic progression in nursing here in this state of Texas. And I think we must do that. We must encourage people to go back to school. We must encourage them to be lifelong learners because we're looking for that better patient outcome. And so when we have a better patient outcome, that means we're doing the right thing in our education and training of nurses. So for me, the other piece of research is how do we move people forward? How do we provide traineeships? How do we provide scholarships? How do we provide mentoring to move people forward? And how do our employers, what's in it for them? So I think it's really important and critical that we see our world not just in an ivory tower of educating people, but we are really looking at ourselves as an economic engine. Nursing is an economic engine. So if we can decrease the number of hospital readmits, or if we can shorten the length of stay, if we can have better outcomes for our patients, they don't have decubitus ulcers, or they don't have nosocomial infections, or they have fewer falls, or they have fewer incidences of problems while they're with us in the hospital, we're saving the hospital a lot of money. So that baccalaureate nurse becomes really, really valuable for the hospitals because they are able to then to save money and have really good outcomes, and patients love us. So all of that kind of comes together, I think. So I think research, if we don't look at our research, is how is it making a difference, and how could it even make a difference economically? And making people healthier, having better access to care, having better opportunities for health prevention or illness prevention and health promotion. Those are the things that research should always be about and moving us forward as a profession and earning and learning new knowledge. The concept of leadership and the concept of nurses' voice is so important today. If ever there was an important time, nurses really need to step up and become leaders at the bedside, become leaders in their hospital world, in the units where they work, become leaders and have a voice wherever they can find an opportunity. So say you're at a school board meeting and you have something to say. When you start by saying, "Hi, my name is Kathryn Tart. I'm a registered nurse, and I'd like to comment on whatever." That's a very small, easy way of being a leader and having a voice. Because as soon as you say you're a registered nurse, people will listen. They will listen to you because you have an education and they know you care about people. You have a heart that means that you are interested in the well-being of others. So just by saying that very simple comment, it will put you in an area where people will want to hear what you have to say. So for nurses, don't think that your voice is non-consequential. It is very consequential, is very important, and people want to hear what you have to say. So don't be afraid to be a leader. Don't be afraid to sit on boards. Don't be afraid to run for office. Don't be afraid to move forward because you have so much to say for our future. Don't be afraid to say to your senator, "Hey, I'm boots on the ground for you. I will do whatever you need." Or your legislators to say, "I will do whatever you need. I will get the information you need. I will get the evidence that you need so that you can make really good decisions. I will sit on any committee that you would like me to sit on," because nurses' voices need to be heard. And if we don't speak, nobody will speak for us, or other people will speak for us. And so they will maybe give a story that's not our story. So it's really important. And I think being here at the University of Texas Health Science Center in San Antonio gives you the training and gives you the skill and hopefully encourages you, inspires you to see the vision for the next 50 years to be those leaders and those voices that I think our world is longing to hear.